One area that I think is really exciting, and again, not only in lung cancer, but in all of oncology, is this idea of testing the cancer genome. This often gets lumped in with this term personalized medicine, which I know gets overused. But the idea is relatively simple. Can we learn more than just what the pathologist is telling us by looking through the microscope? Can we begin to understand, are there switches or engines that are causing this cancer to grow or be driven in a certain way? Because perhaps if we can identify that, there might be a more appropriate way to target the cancer, to turn off that switch or turn off that engine. And this really gets into the whole field of what's called molecular or genetic or genomic testing. And I want to talk to you about that a little bit in terms of squamous lung cancer. So one thing that's been exciting to observe in oncology has been the pace of development in terms of technology that's here now, that's actually in our clinics, not just limited to one center in the country, but now in our clinics. And that allows us to test cancers and look at the genes within the cancer. What I'm showing here is a really important publication that just came out in one of the major medical journals called Nature. And I know this is a very complicated slide, and I'm not showing it to kind of walk us through every detail here, but what this is displaying is if one looks across not just lung cancer as shown on the far right here, but if one looks at other tumors, and so if you begin on the left, that AML stands for leukemia, BRCA is breast cancer in blue there, and then go across the colored row there, you'll see at the far right it says LUSC, that's squamous lung cancer. And what this slide is just meant to show is that all of these cancers have genetic abnormalities that can be uncovered, and those are shown in more detail at the bottom part of this slide. And actually, squamous lung cancers are at the far end of the spectrum here. What's not shown here is melanoma and small cell lung cancers. These cancers are very complex tumors, and it probably has a lot to do with the fact that smoking causes additional changes or alterations in the genes of these cancers. And these complex tumors could be driven by many different signals, and trying to understand and tease out which signals are responsible for Mr. Smith's squamous lung cancer growing and which ones are responsible for Mrs. Williams' lung cancer are really important in trying to personalize how you're going to approach treating those patients. And this is really what's garnered a lot of the excitement and optimism for helping patients with any cancer, but certainly lung cancer now. What I'm showing here is a list of known switches or genes that are known to be altered in lung cancers. And this list is not limited to squamous or small cell or non-small cell lung cancer. This is a list simply of genes. Each one of these terms, so for example, ALK, I think many are very familiar with, but further on the list is BRAF, BRAF. Each one of these terms represents a potential genetic target that can be tested for now. And the question is whether these targets are potentially relevant or important in a particular patient's cancer. So we now have the ability today to test for these targets. And Dr. West and others know very well that each month this list is growing because of what gets discovered as being present in lung cancer and because of technology. The question really, the challenge for all of us as providers, as researchers, is trying to understand what is it in this list that could be relevant in helping my patient. Now, what's highlighted here in red are terms I think many on this call are familiar with. So ALK, EGFR, ROS1 at the bottom of the screen. Those are alterations that I think many are familiar with, are already well characterized and known to occur in non-squamous lung cancers. And in that information, knowing if a patient has what now gets termed to be an ALK-positive lung cancer or a ROS-positive lung cancer or EGFR-positive lung cancer, those are such crucial pieces of information because that leads to the selection in those cases of oral therapies for those patients. Certainly chemotherapy is going to be used at some point in their care, but the very first therapy might be a pill. One of the exciting things in squamous lung cancer is whether any of these alterations could be important, something that really has not been recognized until recently. This is a recent publication from Jeff Oxnard at Dana-Farber, which I think more simply highlights what we're talking about here. On the left here is shown what is termed non-squamous or adenocarcinomas. And if you look at the whole group of patients who have, say, adenocarcinomas on the left here, in the gray segment, we know there are these things like EGFR, ALK, and ROS, certain mutations that drive those cancers. We know that there are other alterations that are present, but we haven't well characterized those, and that's what's shown in blue there. And then the yellow bar is supposed to represent kind of an emerging area of potential targets, actually ROS or BRAF might be in there. If you look at the right side of the slide, this is squamous lung cancer. This is a fair, I think, representation of where we are right now in squamous lung cancer, so that most squamous lung cancers probably have unknown oncogenic drivers, so unknown genes that are responsible for switching those cancers on. But there's a sizable portion of squamous lung cancers, maybe as high as a third, that have potentially targetable genes. And to me, that's so exciting because we've never really thought of squamous lung cancers as being things that could be treated with anything other than standard chemotherapy. And this is something that really has surprised everybody in the last couple of years, and nobody doubts that that yellow segment of the pie is going to continue to increase, not only for adenocarcinoma on the left, but squamous lung cancer on the right. Shown in a little bit more detail is work that several important groups have been involved in. This is from a pivotal paper out of the Cancer Genome Atlas project involving many investigators out of Boston and St. Louis and others around the world, just trying to show you that a lot of work is being done and pivotal publications are emerging now trying to map out squamous lung cancers and map out these relevant targets. This is just shown in another way. I don't mean to make this too complicated, but just want to show you that a lot of work, a lot of targets are being found, and we're getting closer to understanding the frequency of these abnormalities shown under SCC, squamous cell carcinoma. Of course, on the right there is adenocarcinoma. I provide this as a reference for you to show that a lot of work, a lot of important findings are being made. And then shown just in a cartoon form is kind of this 1/3 of the pie. Here it looks more like 40% of the pie, but one can see that now the entire pie isn't just green and unknown. We have several segments or wedges of the pie here where there are potential targets and worthwhile approaches, at least from a research basis, of trying to target squamous lung cancers now. And I want to remind everybody of this. This actually is an important slide that really came out this last year. So the NCCN, the National Comprehensive Cancer Network, is certainly an institution that produces guidelines that really all oncologists, I would say, in the world recognize to some extent, but certainly in the U.S., this is one of the main sources of kind of roadmaps for clinicians at academic centers and the community on how should I manage my patient. If one looks at the latest guidelines that have come out for squamous cancer and the issue about genetic testing, this is an important point I want to make. So I'll just read this to everybody, that for squamous cancers, consideration of testing for things like EGFR and ALK should be made, especially in our patients with squamous lung cancers who are never smokers. I mentioned to a gentleman I met 2 weeks ago who's a never smoker. He's somebody that has not been tested yet, but we're in the process of doing that now. Also, there can be patients who have squamous cell cancers diagnosed using small biopsy specimens or even mixed specimens, like I mentioned before, where a doctor says, I'm not sure, David, it may be squamous, maybe adeno, I'm not sure. And the reason this box is here in red is because the contributions that have been made from many studies now that demonstrate the value of oral therapy in patients with EGFR mutated or positive lung cancer or ALK positive lung cancer. It's such a major step forward in how we care for patients with lung cancer that one wouldn't want to deny that opportunity for somebody just because a name on a pathology sheet says squamous lung cancer. Now, we know historically the chances of finding an ALK positive or EGFR positive squamous lung cancer are tiny or small, and I showed that before on some of the earlier slides. But if there's some uncertainty about the diagnosis of squamous lung cancer, and it may be actually a mixed tumor, it may be an adenocarcinoma, one doesn't want to deny that opportunity to a patient. And again, I think there can be these other segments of patients who are never smokers, don't fit the typical kind of clinical picture of squamous lung cancer, who, frankly, we don't know enough about to know that testing isn't valuable in those patients. So this is just kind of a caution, a warning, saying not that squamous lung cancers across the board should be tested, but that it should be considered in these circumstances. Now, I'll speak for Dr. West and a lot of my colleagues who believe that we're not far from a day where hopefully all of our patients will just be tested for a whole panel of abnormalities. And it doesn't matter so much that you have small cell or squamous or large cell or even colorectal or breast cancer for that matter, that you just get tested, period. But right now we're at a place where we try to certainly be smart about how we test. Are there even therapies available for these patients? And that's why these guidelines are kind of slowly evolving.
Thanks for listening. If you like and learn from our GRACEcast, you can subscribe on iTunes by just searching for the term Cancer Grace, find podcasts in the subject you want, pick a format of audio or video, and then just click subscribe. It's that easy. And for those of you who don't want to miss any of our programs, there's even a feed for all subjects. You can also find us on YouTube at Grace for Cancer Info, and that's the number 4 in one word, Grace for Cancer Info. Finally, if you haven't been there yet, please check out our Grace website at www.cancergrace.org. And don't forget that donate button in the upper right. Our content, which helps tens of thousands of cancer patients around the world every month, is made possible by your support.